Housing is healthcare. So what does that mean and why is it important? For your patients, housing provides stability that enables them to access primary care, behavioral health, substance use treatment, and medication. It also provides safety and access to basic needs. With housing as a stable foundation, your patients are better able to take proactive steps to accessing the healthcare that they need. In this short video, we'll share how housing can be the platform that leads to better health outcomes and help you to better support your patients who may be experiencing housing instability. When patients don't have access to stable housing, their health can decline. However, there are many contributing factors that will influence health outcomes. People experiencing homelessness are exposed to many environmental and situational hazards while trying to seek shelter. For example, think about people who are unsheltered or in emergency shelters. They're often exposed to communicable diseases by living in crowded communal settings and not having access to the appropriate facilities necessary for maintaining hygiene. Without access to a regular, stable place to call home, there is risk of exposure to the elements and a high risk of experiencing crime and violence. In addition, many persons who experience homelessness have complex health needs and may not be able to follow a treatment plan or medication routine due to a lack of a safe place to safely store medications or supplies. These extremely difficult situations have the potential to cause or exacerbate behavioral health issues like mental health or substance use, which perpetuates their cycle of instability. For people trapped in a cycle of crisis and housing instability due to extreme poverty, trauma, violence, mental illness, substance use, or other chronic health conditions, housing can entirely dictate their health and life course. People with unmet social needs are more likely to be frequent emergency room users, have repeat no-shows to medical appointments, and have poorer glycemic and cholesterol control. In fact, many physicians who understand the health and housing connections would write a prescription for supportive housing as a way to improve the health of homeless and unstably housed patients if possible. Access to safe, quality, affordable housing and the supports necessary to maintain that housing constitute one of the most basic and powerful social determinants of health and why we say housing equals healthcare. So how do you start to begin addressing patient social needs? It's important to start establishing connections with the necessary resources so that you can address your patients' identified needs. Do you know what resources are available in your community for housing? As a first step, it may be helpful to start to generate a resource directory as well as building relationships within your community's housing and homeless system programs. It can also be helpful to develop an understanding of the way the programs are administered and to develop relationships with the people that manage those programs. This way, patients can be immediately connected to housing resources once screened. Establishing a trusting relationship with patients experiencing housing instability is key. Without establishing a trusting relationship first, patients could be asked personal questions regarding their housing and social needs with no meaningful plan, process, or context to assist them, which can lead to re-traumatization. It is so important to have a warm handoff to resources. Too often, the concept of a referral is a piece of paper or a static directory with minimal information, and these listings are rarely updated. To really be effective, patients must receive assistance and consistent follow-up with connections to housing programs. One way you can do this is by designating a team member to keep up-to-date program contact information, as well as following through to make sure the connection was made, the receiving agency responded, and the patient was served, if that was their choice. It's not uncommon for individuals to screen for a particular need but decline services or follow-up. Remember, service engagement is always optional on the patient's side, but as a health provider, it's the organization's responsibility to keep an active referral system with up-to-date information and to follow through with every referral made. To be effective as possible, care coordination can ensure patients are receiving both the healthcare and housing assistance they need. Care coordination requires the deliberate organization of a patient's care needs and involving and sharing information among all pertinent providers to achieve optimal outcomes. While fragmentation of care does exist, both in the healthcare system and in the housing system, the goal of coordinated care is to change from having an individual navigate a complex set of systems to instead move towards care that is coordinated at all levels, like housing, behavioral health, and other healthcare needs. The patient's needs are central, and programs should work together to ensure their needs are met. Some key components of effective care coordination in health and housing include systems and providers having the ability to share data, defined roles and responsibilities, care planning that includes the patient, strong cross-sector partnerships, utilizing trauma-informed care and a harm reduction approach. Next, we'll explore some tools that you can use to help capture this data. So what kinds of tools are out there that can help? While there are many screening tools available for capturing social determinants of health, the one currently used by a majority of health centers is the Protocol for Responding to and Assessing Patients' Assets, Risks, and Experiences, better known as PREPARE. PREPARE uses 15 core questions and 5 supplemental questions to collect demographic information and assesses a patient for a host of social needs, which includes housing. The data can then be directly uploaded into many electronic health records and administered by clinical or non-clinical staff. Another important way to not only screen but track housing status is utilizing Table 4, Selected Patient Characteristics in the Uniform Data System, or UDS. Under Special Populations, all health centers have the ability to track homeless status, specifically those that lack housing at the time the patient is being served. Also, Healthcare for the Homeless health centers can track the living status of patients, including formerly homeless patients that are now in permanent supportive housing. This is important data to collect and track because it can help enhance a health center's ability to create health and housing partnerships that can lead to meaningful outcomes. There are also abundant resources out there to support health centers in implementing a screening tool through the Health Center Resource Clearinghouse. Next, we'll talk about some steps that you can begin taking today. Now that we have an understanding of why housing as a social determinant is such a critical component of health outcomes, what are the next steps? Perhaps your health center is among the nearly 25% of health centers not yet screening but in the planning stages of doing so. How far along in this planning are you? What is your process for selecting a tool and creating workflows around screening? Now would also be the optimal time to think about forging those relationships with other agencies in your community. This way, when the screening tool launches, you'll have capacity to immediately address needs in a proactive way. If your health center is among the almost 70% of health centers already screening for social factors, it's important to ask the critical question of how this data is being used and applied to improve patient well-being. As we've discussed, any data collected should have a meaningful plan for its use to ensure patient needs are actually being met. Is there a dedicated staff person in place to initiate and manage relationships with local service agencies? Are there procedures in place for initiating referrals for patients that indicate need? Taking a look at the data already collected will give you a good sense of where to start. For example, if a majority of patients screened have housing instability or are homeless at the time of service, reaching out to your local Continuum of Care, or COC, which is the body responsible for addressing homelessness and managing multiple housing resources, is a logical first step. Alternatively, your local Public Housing Authority, or PHA, is also a potential referral partner for affordable housing. Once you can establish a point person to manage these relationships, the next step is discovering what programs are available and what the intake or application process to access a resource will be. By way of a Memorandum of Understanding, those intake or application services could be provided on-site at your health center. Health centers can even be a point of access to the homeless system, depending on how the coordinated entry process for homeless services works within your community. In the end, access to housing resources should be as barrier-free for the patient as possible and address their housing needs. However your health center decides to approach social determinants of health, the most important thing to remember is tailoring your response to the needs of your patient population. This may require forging new relationships or taking a new approach outside of your traditional space, like developing more on-site service connections or creating a housing partnership. Taking these steps will benefit your patients in the long term by addressing their housing needs, allowing them to focus on their health management and ultimately thrive in their communities.